guys, and welcome to TheraTalks. My name is Fiona.
And my name is Kate.
And today we have a very special guest, Dr. Norman J. Almeñana.
Hi.
Doc, can you introduce yourself, Doc?
Okay, I'm Dr. Norman Almeñana. I'm an orthopedic surgeon.
So, good afternoon again, Doc. So, about tennis elbow, Doc, can you help explain briefly about this case?
Okay, so tennis elbow, it's just acronym, but the medical term, the proper term for it is lateral epicondylitis. So there's pain on the lateral side of your elbow, brought about with swelling of the tendons around that portion, specifically in the lateral epicondyle. That's why it's called lateral epicondylitis. Yeah, but actually the one that swells are the tendons attached to it. Okay.
So, Doc, who usually experience tennis elbow?
Okay, so number one, tennis player na.
Oh, yeah.
It's not just the athletes, no, but ordinary workers also can experience this. So those people that do repetitive gripping, lifting, typing, carpentry, or manual labor.
So, what activities or habits increase a person's risk of having tennis elbow?
So again, repetitive wrist extension and gripping activities are major contributors of your this tennis elbow. Also, poor ergonomics, just as most of my patients here are those that work in the BPO industry. So poor ergonomics, and then they stare for hours without moving their elbows. They just do the typing, and without proper positioning of their extremities. So that can also lead to tennis elbow.
Thank you. Thank you, Doc.
Okay, now for the next question, what are the common signs and symptoms for this condition?
There's a weakness of your wrist extension because primarily, again, for lateral epicondylitis, there's swelling and inflammation and pain on the origin of your wrist extensor. So basically, that's what caused the pain and limitation on the wrist extension.
Okay, Doc. For the last question, what is the one common misconception about tennis elbow that you would like to clarify?
Okay, for tennis elbow, now most people, I've been mentioning inflammation, right? Inflammation, but it's actually not just inflammation, but there's already micro tearing of the tendons around your lateral epicondyle. So it starts as inflammation, but because there's already pain, and most of these patients complain or seek consult after weeks already of experiencing the signs and symptoms. So there's already micro tearing of your tendons. That's what cause most of the pain.
Thank you so much, Doc.
Okay.
And that's the end of our case of tennis elbow. And see you guys on the next episode.
Before we end this interview, let us summarize the important things that we learned today about the tennis elbow or the lateral epicondylitis.
So, we learned that tennis elbow can be caused not only by the sports, but also by the repetitive activities and poor ergonomics, especially in people who work long hours typing without the proper positioning.
We also discussed the common signs and symptoms such as pain, swelling, and weakness during the wrist extension due to inflammation around the wrist extensor muscles.
Lastly, Doc clarified that tennis elbow is not just inflammation, but because there can already be a micro tearing of the tendons when symptoms are ignored for a long period of time.
So overall, this interview helped us better understand the causes, the symptoms, and the importance of the proper posture and early management for the tennis elbow. So thank you so much guys for listening.
And see you on our next episode. Bye, TheraTalks!